Hello, I'm Dr. Stephen Scheinman, Chair of the Institute's Health and Healthcare Task Force. According to the Institute of Medicine, the three core functions of public health are assessment, policy development, and assurance. Federal, state, and local authorities play a role in performing these core functions and delivering essential health services. States have primary responsibility for implementing public health, but the structure and roles of state and local departments of health vary. While some states, counties, and municipalities support a local governance structure for public health agencies, other states have chosen a more centralized or regional approach. The Pennsylvania public health system is a mixed structure, with three different authorities responsible for public health matters: the State Department of Health, county and municipal health departments, and local health authorities. There are currently 6 county health departments and 4 municipal health departments, which cover 41% of Pennsylvania's population. The remaining 61 counties and municipalities do not have a local health department. For them, public health services are provided by a combination of various government agencies and other non-governmental organizations. The Pennsylvania Department of Health was established in 1905. It operates under the mission to promote healthy behaviors, prevent injury and disease, and to assure the safe delivery of quality health care for all people in Pennsylvania, and a vision of a healthy Pennsylvania for all. For decades, funding rates under the Pennsylvania Local Health Administrative Law of 1951 were flat at $6 per capita. The law was amended in 1976 to add support for environmental health initiatives and provided $1.50 per capita to local health departments to cover this. The public health system also relies heavily on federal grants. Departments build their programs and services around federal grant funding, leaving the viability of these services at risk if funding is reduced or eliminated. Local governments are free to add their own funds to support health departments. There have been changes in the organizational structure of the Pennsylvania public health system and the strategies used to shift towards a collaborative partnership approach over the past few decades. The roles of public health departments vary based on the structure of departments and the administration of services at the state, county, and local level. According to the Department of Health, local health departments provide public health programs in the areas listed on the screen. The overall goal of these programs is to reduce morbidity and mortality among the local service population and to promote healthy lifestyles. Several studies have found an association between staffing patterns and overall performance of public health departments. Not surprisingly, health departments with larger numbers of staff and higher staff per population served had better outcomes. As of 2019, Pennsylvania had fewer than 9 full-time equivalent public health workers per capita, far below the national average and the average of other states with a mixed governance structure. The COVID-19 pandemic has highlighted the fragmentation of our nationwide public health infrastructure and the lack of a coordinated pandemic preparedness response. It prompted the question of how the public health system should be changed in order to structure public health functions more effectively and improve our ability to respond to emergencies. The COVID-19 pandemic has highlighted problems in the public health IT infrastructure used for collecting and reporting data on COVID cases, which made it difficult to obtain accurate and timely information on infection rate data. Inconsistencies in the collection of race and ethnicity data among Pennsylvania counties made it difficult to understand how different demographic groups were impacted, potentially putting more vulnerable populations at risk. Collaboration is critical during public health emergencies, and consolidation or cooperation across regions can provide greater efficiency and increased capacity and resources to respond to public health emergencies while reducing disparities in services. There are a variety of policy responses that could be considered to restructure public health functions and improve the ability to respond more effectively to public health emergencies. Advocate for sustained public health funding to help strengthen the existing infrastructure and be better positioned to respond to emergencies. Invest in modernizing the health information technology infrastructure and improving surveillance capabilities. Require adherence to standards for data collection and reporting across all public health agency entities. Strengthen the public health workforce capacity. Develop and strengthen collaborations across regions to leverage resources better and improve capacity. Strengthen partnerships with other community stakeholders to ensure the delivery of public health services at a local level. Stakeholders within the community involved in healthcare delivery, physicians, hospitals, community health centers, have established relationships with individuals who trust their providers to coordinate their healthcare. Leverage these relationships with community stakeholders to coordinate the delivery of public health services at a local level. Engage these partners in emergency planning and response efforts. Collaborate with other stakeholders that support community initiatives, such as the Institute, to help with research to assess and support community needs. Thank you.